So my name is Niroshan Sothilingam. I'm one of the general surgeons in town. I'll warn you now, I don't have any of these gross hernia pictures that Dr. Ojak put out. So my project was on VTE prophylaxis in post-op cancer patients, and are we doing enough in this province? This has been studied for the last 15 years or so, and there's lots of data. These are all North American and European data, and the evidence is clear, and everyone says the same thing, that we should be sending our post-op major cancer patients home on 4 weeks of VTE prophylaxis. It's safe, it's effective, and it's well taken in many places in North America. Unfortunately not here. So the challenge is this. Currently we don't have a protocol in our health region, and I bet in the province, to make this happen. So we are currently failing Accreditation Canada's requirement on this, which means that we're also failing our patients and not recognizing the VTE risk in them. Unlike other provinces, Saskatchewan does not pay for post-op VTE prophylaxis in these patients, so the cost is on the patient. And there's a big buy-in. You need the surgical community, the pharmacology community, hematology, the health authorities, and the patient to want to do this. So calculating the risk, again, this has already been done for us. So when Joseph Caprini did this in 2005, and over the last 10, 12 years or so, has been very well validated. And we've got a scoring system that can categorize what sort of risk someone is in for VTE. So I don't know if you can see that, but that's our pointer. Right there. So you get 2 points for each thing. So if you're over 60 and you've got a malignancy and your cancer surgery is over 45 minutes, either open or laparoscopically, you get a score about 6. And if you go down to this chart on the other side, and then right about here, you can see you're fairly high risk. So your CAF DVT anywhere from 20 to 40%, and so on. So all the work has really been done for us already. Now the team, like a lot of my colleagues said today, I have to echo that and say, look, I started off with having a massive goal, but then thanks to this amazing team that we have, really brought it down to something very manageable and doable. So the method, we kept it simple. So if you're over 60 years old and you're having cancer surgery in the abdomen pelvis, and it's more than 45 minutes long, which is all typical cancer surgery, then you qualify. So what we did was from April to the end of June, we collected the baseline data, and the 2 things we really want to know is this. Was there a prescription on the chart for when they went home for 4 weeks of VTE prophylaxis? And that's something we collected on our own. And the second component of that is, well, did these patients actually fill the prescription? That was information we got from the Ministry of Health. So July 1st, we put an intervention into place, and then after that, from July to end of September, we collected similar data as before to see, well, did our intervention do anything? Our intervention was education and knowledge, and at the end of June, I went around and talked to anyone who'd listened to me about this and said, this is what we want to do. So, you know, the nursing staff, the educators on the wards, the physicians, the residents, out of time, all right. So results, come see me. I thought the results were actually quite interesting, and I have to thank my team, because without them, this would not be possible.